everyone, my name is Ibreez and I work as an internal medicine trainee in the United Kingdom, and this next lesson is going to be on core training or not. Dun, da, da. If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe. So we've just finished talking about whether or not you should do foundation training, but now we're going to talk about whether or not you should or even need to do core training. Right? If you remember earlier, we were talking about competencies and we were talking about what you require person specification wise, and a lot of that plays very heavily into this lesson as well. Because when you think about when you're applying for any sort of training that has a earlier portion, a core portion, like in internal medicine training or core surgical training, if you're already otherwise qualified and you've completed membership exams, which are the requirements that need to be completed within this core sector, you don't have to then apply for core training again. That doesn't mean to say you can't if you meet those person specifications, but you aren't required to. If you can complete your alternative core competencies and you can get those forms signed off, and if you meet everything that is laid out in that form, you can then just directly apply into higher specialty training. All right? This is another point that I want to make here is if you see that in certain specialties, such as in surgery, if you already have 18 months of post-internship surgical experience, you cannot apply into core surgical training. And a lot of times people get very concerned, does that mean I can never apply to be a surgeon in the United Kingdom just because I have more than 18 months? No. This 18-month requirement means that you cannot apply for core surgical training. It doesn't say anything about higher surgical training, where on, you're at ST3 or ST4 level. Anything beyond that, you're still eligible to apply. So if you've already completed MRCS, you meet the requirements for your alternative core competencies to be signed off, you feel pretty good about doing it, maybe you've done a non-training job for a little bit of time just to understand the system and adjust to the NHS, you can go ahead and apply for that higher specialty post, all right? In the time period within which you want to do a non-training job, you can put together a portfolio, you can speak to other colleagues, you can understand what needs to be done for you in order to apply for that specialty training, but don't think that you need to start off at core training. That being said, if you still meet the person specifications to apply for a core training, core training level or core training posts, and you've even completed membership exams, you can do it. If you meet the person specifications, you can still apply for core medical training and then go on to your higher, specialty training. And there are people who have done it, but it's up to you. You don't think that just because you've done all this experience, you've got all this stuff done from back home, that when you come to the United Kingdom, you need to start at the very bottom and do it all again. If you see what the specifications are and what the requirements are, and if you meet those requirements, you don't have to subjugate yourself to the entire process again. Instead, you can apply at the level that is most appropriate to what you can bring to the table. So I've told you that you need to get your alternative certificate of core competence signed off, and you might be like, well, hold on, how do I go about doing that? If you watched the last lesson about, foundation training or not and how you can go about making sure your CREST form is signed off, it's really not that different. So if you want to take a non-training job, what you'll need to do then is first look at this alternative form, see what the requirements are, see what the trainees at a core level are doing and what they're putting in their portfolio. Get a portfolio, find a clinical supervisor who can guide you or someone else to be your mentor to help you along that way, and set those targets, set those goals that this is what I want to accomplish within this time period so that I can apply for this higher specialty training. Now, while I had said for CREST you could probably do it in about 3 months if you're really good to get the CREST form signed off, that isn't necessarily true about this alternative competencies. There's a lot of stuff that you need to show. You might think, well, then what's the use of that? I might as well just do core training, and that's perfectly fine. That's perfectly acceptable if you want a little more of that structure and maybe somebody there to always kind of be guiding you if you feel that it might be difficult for you to do on your own. But we've known people, and it is very possible to do it in 1 or 2 years versus having to do 3 years of core training. But again, it's up to you. If you want to do it on your own terms and on your own time and at your own pace, it is very much possible for you to do that. Don't stress out that you have to do core training, or don't stress out that you're not going to do core training. It's just about getting that form signed off and being confident in what you then later apply for and putting that portfolio together appropriately. Now, beyond what we've already discussed and what may be obvious for what you need to provide for your specialty training application, what you should do, for instance, if you want to apply an ST3 in urology, take a look at their person specifications. There might be some extra things there that they recommend or they want as desirable, or they might want for you to have done. So go through those things and then try and make sure that you have it. Another question you might have in the back of your mind is, well, hold on. If I, bypass doing the core training and I directly go into higher specialty, what's my end result going to be? Am I going to get a CCT or am I going to get a CSR CP? Don't fret. We've got that in another lesson coming up. But for the time being, I hope this lesson did make sense to you about whether or not you should do core training. And I hope you guys can get ready for our next lesson on specialty and subspecialty training with special interests.